So, in terms of the actual campaign itself, then, so Stop Smoking, Feel Happier, that was a regional campaign um, delivered by Eski and the South East Smokefree Alliance. And the whole thing around this is it's about challenging a long-held belief that smoking relieves stress. And there'll be experts on this already on the webinar. And if you're not, you'll know a bit more about that by the time we get to the end of it. Like many great things, it started in Hull. We were building on a small-scale campaign that was co-produced with smokers in Hull and working with the public health team at Hull City Council. And the whole thing around this was it's informed by behavioural science and mental health expertise. So the campaign really reframes quitting so that it's actually about improved well-being and happiness. The campaign itself ran from Boxing Day 25 up until mid-February of this year. It was delivered at scale across 18 local authorities across the southeast of England. And that was using a mix of TV broadcast, radio, digital, outdoor and face-to-face engagement, which we'll tell you a little bit about as we go through. But the reason that we're holding this webinar is because it did actually achieve exceptional results. And towards the end of the presentation, I'll go into this in more detail, but by way of a headline, the independent evaluation that was done on this found that 87% of smokers who were aware and were able to recall the campaign took action. So that equates to an estimated 73,923 setting a firm quit date or a strong intention to do that, to quit as a result of the campaign. And as I say, I'll go into more detail about that at the end of the webinar. But to kick us off and to give us a flavour, we're going to play for you now a 40-second animation, which was the TV ad version of the campaign to set the scene. There's a lot of people on this call, so it might be a bit jumpy, but the audio will pick it up. So let's watch that.
Fact is, people who stop smoking are happier. It's been proven, and it can start to work within weeks. The good news is, it doesn't matter how long you've smoked for or how many times you've tried to quit. Being addicted to nicotine tricks your brain into thinking that smoking is the only thing that eases stress and anxiety, when really, it steals our happiness. But by quitting, your amazing brain starts to relearn how to produce dopamine, your happy hormone, all on its own. A happier, calmer, less stressed you is just a few weeks away. For free support today, visit quittogetherlivebetter.com.
So that being a TV ad, you'll know that we've got to go through Clearcast and get those facts checked. We're not going to talk too much about that in the webinar, but just to anticipate any questions on that. Just before I get into this one, the way this is going to work, we're going to give this formal webinar and then we're going to end, and there's an optional Q&A part at the end. If you want to drop any questions in the chat, we'll make sure we get to them, or if you want to hang around and turn your microphone on at the end, you'll have that opportunity. So the first lesson that we're going to learn from that is around effective campaigns change the narrative. And as pretty much everybody on this call will know, we've tried all different angles on smoking. And what's slightly different about this campaign is what Dr. Sarah Milne, who's the lead of the South East Smokefree Alliance, described as a light bulb moment. And when she spoke with people, they said it was like this sudden realization that their habit was based on a false promise. So this is about getting to the root of the cause of why people smoke, rather than repeating the sort of well-worn path about health harms, and actually looking at this again, like questioning our own motivation. So in behavioural terms, this kind of message would disrupt cognitive dissonance and really ask that question: if smoking isn't helping me, then why do I do it? So in terms of the messaging from that, it goes from long-term risks to immediate benefits. Traditional smoking campaigns, as I mentioned, have focused on like distant health consequences of cancer and heart disease and premature death. And this one is about a more short-term message around reducing stress and improving happiness, and explains, as you've seen in the ad, that smoking disrupts dopamine, that feel-good chemical that we have. And so it sort of reframes the whole thing, and it's not about avoiding illness later, it's about feeling better now. The other thing is it's moving around from fear to empowerment and positivity, and it's about trying to regain control of the brain chemistry to improve our well-being. So again, this isn't about alarming people, which is done in lots of ways, and I think it's that mix of messages that we all do that has its place. But this is much more about making change feel much more achievable and beneficial when you get there. And it's also about moving from habit justification to myth busting. As already mentioned, a major barrier to quitting is the widespread belief that smoking helps manage stress. And this campaign is all about trying to show that actually, biologically speaking, smoking can increase that stress. And it's about contradicting that common justification that people have for the habit. And it's about moving from awareness to action-driven messaging. So we've got awareness of that information, but actually it has been seen to drive behaviour change. There are people on this call who've also worked on smoking and mental health awareness campaigns. I'm sure we'll be able to point out some of their results as well. But what we found here is that 87% of the smokers who took action, such as setting a quit date or seeking support, they were more than twice as likely to do that than those who weren't aware of the campaign. So as I mentioned earlier on, I'll in the point 5, I'll go into a little bit more detail about that. But for now, I'm just going to hand over to Alice for our second reflection.
Lovely, thank you, John. So I'm just going to go over the digital platform data and kind of how that works in terms of the campaign. So the platforms we used that we will be touching on in this section were Spotify, Instagram and Facebook, so the Meta platforms, Google Ads in particular, YouTube and TikTok as well. We picked those for different reasons based on kind of the research that we've done previously and what's worked best on previous campaigns, and really honing in on the demographic that we want to reach there. As John mentioned, we also touched on TV. We did, and that was through Sky. We did radio as well, kind of like the streaming side of radio, to reach the masses again, and out of home, so kind of like the digital screens outside shopping centres and stuff. But in terms of the data that we can grab, this is purely just going to be focusing on social media. So as you can see here, there's kind of like a table in terms of the stats that we got from this campaign. So the budget allocation was a little bit different for this campaign, as there was 18, I think, different local authority areas within the signed up to the South East Smokefree Alliance that kind of put their invested into this campaign, and each of them provided their own little pot of budget. Some areas were able to provide more of an investment, and some not so much, which again we were going to see great stats across all, no matter what the investment really. But I think as we liaise with Sarah and the other areas, again it depends just how much you put in as to what the outcome is. So below, as discussed, shows a breakdown of stats. These are for each area combined. There is a report that's got a massive breakdown, but just in terms of this is just everyone combined. So Meta platforms, we always tend to front load these in terms of the budget, just because we know in terms of the reach and demographic, we're really able to hone in on that and reach the masses with that. But also there's TikTok, Spotify and Google. So as mentioned, Meta platforms are great for the reach and the awareness. But as we can see here, Google, in terms of link clicks, did really, really well, which is great. We haven't really delved into Google that much in previous campaigns, but I think this was the first one when we kind of saw, right, okay, we can need to implement this with every single one moving forward. So you can see here that there's a really positive amount of link clicks and impressions, and also reach. It's worth noting here that the objective for the campaign was traffic to the individual smoke-free websites across all areas. So that's kind of where the budget was pushed towards, people that are more likely to click onto these ads. We have included Spotify here as well. As you can see, again, the cost per 1,000 reach was pretty high, but I think this is in terms of, we still include Spotify because it's a great way to reach the masses, in terms of most people nowadays do have streaming audio and things like that. So you can see here the reach was really impressive, and also it's worth noting that the links were as well, considering it's literally just an ad that you listen to in your earphones. It prompted a lot of people to get out their phones, kind of stop what they're doing and click on the ad, which was really positive to see overall. So you can see here again, as I've mentioned, that Google kind of came out on top in terms of link clicks, and you might be thinking, why can't we just throw all the budget on Google, which is a fair enough question, but we do like to continue to carry on doing a kind of a spread across all platforms, in particular Meta and Facebook, just because Google, especially with YouTube, you are limited to the content you can put on there. So for example, obviously YouTube, it's just video format. But in terms of the meta, you can do stills, carousels. It's just really accessible. And majority of people, to be honest, do still use Facebook over Google. So whilst Google still proves to be a really valuable platform, it's still definitely worth looking at those other platforms as well. And in terms as well, there's a column there that says for engagement, Meta, TikTok. You can really measure that kind of engagement in terms of comments, likes, shares, all of that stuff, but it's a little bit harder to do in terms of Spotify and Google. I think that's everything on this section, so I'll pass back over to yourself, John.
Thanks, Alice. So the third point is around the commissioning and the commissioning leadership of this, and actually how that goes from something which can be good as a standalone campaign, but on to great. So the model for this, as we've mentioned a few times, was through a Smokefree Alliance. So this, for some of you on this call, are members of alliances, so you already know this. Some of you worked on this campaign, so you are aware of this. For anybody that's not, these are set up regionally and are a combining of financial resource and knowledge to be able to do a number of things, including running public health campaigns at population level. So Alice has used that phrase to the masses. They will be talking about it, and really that's based on the evidence that if you do things at that large scale, you will be able to have more of an impact, and it's that sort of compound effect that you would have rather than doing it individually. There is still, of course, a huge place for targeted work, social marketing, as we used to call it, some people still call it, which is around understanding specific needs of the target groups and communities that we're working for. And I don't want to give the impression that that doesn't happen with a campaign like this, but it's tailored. As we've mentioned, there's 18 different local authorities that are participating in this particular campaign who will have been tailoring this in the way that they implement the messages, who provides those messages when they do outreach work. And we know that some of the local authorities actually took the assets that we developed and ran their own ad campaigns their way. They already had that capacity in their team or worked with an agency. So the idea is that we've got this sort of sitting over the top initiative working across the region, but it can be localized and targeted. In terms of this particular alliance, then the goals that South East have is around large scale multi-channel public health marketing campaigns, which we're talking about, advocacy and partnerships, supporting expertise and research. So this is one of the first of a number of initiatives that they're going to be running, but they become interlinked, and there is some learning and transferable skills that you get from doing that, which Alice will explain in the next point. But what I wanted to talk specifically here was that commissioning model means you've got economies of scale, it's very efficient, but it's not just about paying for it and then giving it to Eski or whoever it is that's delivering it, just to get on with it and deliver it remotely. The passion and the dedication really does make a big difference on this. So either on this call or watching the playback will be people that we work with, like Katie Connolly, Scott Crosby, and Sarah Hepworth, who are leading alliances. And you can just tell how much passion that the people really care about it. They actually can see the real benefits of helping people stop smoking at this level. And although we're talking about statistics, this is individual lives, and it just makes such a big difference to have that positive working relationship. So it's not about commission somebody over to you, we'll see you at the end and see how you got on. In the case of Sarah on this one, Sarah jumped on public transport and went right across the South East for a series of roadshows that ran throughout the digital aspects of the campaign. So whilst Alice was orchestrating all of the population level communications, Sarah and colleagues at the providers and local authorities as part of the alliance were actually going out meeting people and talking to people, and that just gives you a wealth of understanding and feedback that you're not going to get just by running a campaign purely remotely. So whilst we were working hard and I hope implemented it pretty smartly, what Sarah was able to do was align those partners who were proactive about it. We all came back from the Christmas break and then straight into this campaign, going out and interacting with people, which I know we've got callers on from New Zealand here, but in January, the UK is not the most warmest and often hospitable of environments to be in. So to actually go on to do that and actually get the feedback and see the difference it's making for people's understanding of smoking and why they do it, and how to see them questioning smoking, as I talked about in the first point. That gives us that validation, that gives us that quality as well as the quantity that we've got behind the numbers. Okay, and I'm going to hand back to Alice for our fourth lesson then.
Super. Thanks, John. So embedding messages outside of the campaign provides sustainability. So since the campaign launch, well, we've been working alongside Sarah, but previously, recently, we were asked by Portsmouth Council to look at doing further kind of like training packages, doing some videos that can be used to share with partners and everything like that, just to kind of touch on points that, again, are spoken about during the campaign. So it'll be a range of training resources and materials for professionals. And whilst Portsmouth do have we are creating their own version for Portsmouth, it'll be part of a larger package that will be available to every member within the South East Smokefree Alliance, to create something larger, and that'll be available. Again, everyone will be aware when that's ready. But for context, last month the team at Eski, we went down to Portsmouth and we filmed a range of videos alongside Portsmouth Council, which included appearing at local food banks, community centres and a recovery and substance misuse service centre, just capturing very brief advice in real life settings and an overview of what that looks like. And then also touching on the nicotine and dopamine cycle, which again draws back to the whole campaign. I know we have leaflets and posters and things that talk about that. So again, it's just linking back to that campaign, making sure the message is consistent, and we just keep building on that message there. We are planning to head back down soon to film the CPD webinar, which again, as mentioned, will be part of the larger training package that will be available for professionals to watch, and I think it'll be part of an interactive course as well. So that's exciting to work on. So that'll again help to shape the campaign further. But as an example of some work that we did outside of the campaign previously this year, we did the CPD webinar kind of like as a short video, just a short animation, which I will share now, which again leads to further training and further resources on that.
When you inhale tobacco smoke, its chemicals reach your brain in just 10 seconds. Nicotine rushes in and latches on to tiny switches called nicotinic receptors, controls for attention, alertness, mood and reward. But nicotine overstimulates these receptors. Over time, your brain rewires itself to expect nicotine just to feel normal. This is how dependence and addiction begin. Nicotine also triggers a surge of dopamine, the brain's reward chemical. That hit of pleasure teaches your brain, smoking feels good. Do it again. Soon, smoking becomes tied to everyday moments, coffee, work breaks, and to feelings of stress relief. Here's what really happens between cigarettes. Nicotine levels start dropping within 30 to 60 minutes after smoking. As they fall, your brain reacts. Dopamine dips below normal, and the overstimulated receptors send distress signals. This leads to irritability, low mood, poor concentration, cravings. This discomfort is nicotine withdrawal, and it also activates the body's stress system. Stress rises as withdrawal builds. When you smoke again, the stress briefly disappears, but only because you've temporarily stopped the withdrawal your last cigarette created. And so, the cycle strengthens. Nicotine also briefly boosts serotonin, the chemical that helps regulate mood and emotional balance. But with ongoing smoking, serotonin receptors become desensitized, mood regulation worsens, and anxiety can increase. When you quit smoking, serotonin starts to stabilize. Many people experience mood improvements. At the same time, cortisol, the stress hormone triggered by nicotine, begins to fall. Emotional balance returns, and many people feel calmer within weeks. The brain adapts quickly. Nicotine receptors return to normal, dopamine and serotonin rebalance, and stress responses settle. With time, people report clearer thinking, improved mood, and stronger emotional resilience. Quitting smoking is one of the most powerful steps you can take for your mental health, and your brain feels the benefits almost immediately.
So if you didn't know that already, we all know a bit more about smoking's effects on the brain. So the fifth point that we wanted to reflect really was about the independent evaluation. And we haven't got time, but I could easily talk about this for an hour plus because such a thorough job was done. So South East Smokefree Alliance commissioned a company called Information by Design to carry out the independent evaluation on this. The sample size that they worked with, where they did the pre-campaign survey, was 1,253 in the first phase, and then they did a post-campaign survey of 836. I am no expert at this, but I believe that just about makes any of the findings, does make them statistically significant. And from there, the 24% of the campaign where 24% of smokers were aware of the Quit Smoking Feel Better campaign when prompted with campaign images. And when you understand that, that's when we can start digging into some of the more at-scale understanding. So whilst I mentioned earlier on, Sarah and the members of the Alliance were going out and doing face-to-face interactions, which is really useful to get that anecdotal evidence. This quantitative stuff, I suppose, is what gets people to sit up and take notice, and we can dig into those numbers and help us improve things for next time. One of the questions that people were asked is reflected on this word cloud on the slide there, which was around what, if you've seen this campaign, what do you think it's about? And it's just it's a simple measure to see, do people understand it? And you can see there, quitting and mental health, stopping. They've got to grips with it just from seeing that brain image that it's gone through and they understand it. In terms of the actual numbers at scale, the title of this webinar was around how we influenced over 150,000 people. That's really where that claim is where these figures come from. So based on applying the percentage of people who were aware of the campaign against the estimated numbers of smokers across the areas in the southeast that we were working on, which is just almost 820,000. Information by Design then calculated that what that reckons is that 167,745 people will have taken action. In a moment, I'll explain what we actually mean by that. But as I mentioned earlier on, one of the really stark points from this is that they also measured the amount of people who weren't campaign aware and what their behaviour and attitudes were. So when we're able to pick into that and understand it, we can see the difference as is illustrated on the next slide. And you can see here the lighter yellowy bar that you've got at the top are those who were campaign aware, and the orange one is the campaign unaware. So this demonstrates that there was stronger impact amongst those who were aware of the campaign, and 87% of those who were aware have a plan or have taken action to stop smoking, and of that specifically 38% have set a quit date or have a plan to set that quit date. So the fact that you can see the differences between the top bar and the lower bar here around how they've actually taken action is really where it shows that this isn't just about awareness, this is influencing behaviour. And if you look at the one at the bottom which says none of the above, what that's saying is 56% of people who weren't campaign aware haven't taken action, but only 13% of those that were campaign aware. And that breaks down across a number of different things around talking to your GP, a healthcare professional, visiting the website, looking at NRT, setting the quit date, etc. So again, we can start looking at that and measuring it. What I would say is that there was a bit of a disconnect between what the services have seen in terms of people contacting and saying, well, all these people saying they're stopping smoking, but we're not seeing a huge increase. And bear in mind, it's 18 different local authorities we worked on, so you saw a bit of a variance with that. That's a real lesson learned for us, and we're looking at how we can do a more uniform data capture way of doing that across the campaign, so we can really see tangible measures of who has actually therefore access to service now, because we know they're 3 times more likely to succeed when we do that. What I will say is another lesson learned is in terms of like data protection, that's much easier said than done. I think that the Alliance, we're looking at something that was a relatively straightforward way of doing it, but people have asked questions. So watch this space on that one. But if we can do that, that's ultimately going to help us better understand the effectiveness of a campaign. So we've rattled through 5 lessons learned there. I'm going to hand back now to Alice to recap. And then, as I said earlier, we're going to end the formal part of it. We're going to stop the recording. And if anybody wants to stick around for any questions or chats, you are very welcome to do so. Thank you.
Thanks, John. So just to quickly go over to summarise the 5 key points that we've learnt today. So effective campaigns change the narrative. Digital platform data informs optimum reach and engagement. Commissioner leadership takes a campaign from good to great. Embedding messages outside of the campaign provides sustainability. And independent evaluation informs you on how to get better. So, as John mentioned, that now concludes the final formal part of this webinar. Thank you everyone for attending, and we hope that there's something in there that you can apply to your upcoming campaigns. And if you are interested in licensing or adapting the campaign in your area, we'd be happy to explore how that might work with you. We'll stop the recording now, and if anyone wants to stick around for further comments or questions, we can do so for a couple more minutes. Thank you again.